Part 1 of my life, his story. It's been a long-running joke of mine that I've had Crohn's since the womb. However, my earliest memory of having stomach issues was at 8 years old. I can remember eating a couple bites of food and then spending at least 30 minutes in the bathroom. I never really remembered not having stomach issues, so I never really thought it was something I needed to tell my family about. As time went on, I developed what we thought was just a nervous stomach, meaning anytime I would get anxious or worried over something, I would immediately run to the bathroom and spend 30 minutes or maybe longer in there. My dad had stomach problems, so we just thought it was some sort of genetic thing. But that all changed when I was 11 years old. I went to the bathroom one day and discovered I was bleeding from the rectum. I told my mom, and she got me an appointment with my pediatrician the very next day. Upon examination, she discovered what looked like hemorrhoids, but they weren't, and she didn't know what they were. So she referred me out to a local colorectal surgeon. He suspected Crohn's right away, but I was missing a lot of the key symptoms that Crohn's patients usually have. Instead of diarrhea, I had severe constipation. Crohn's was known to hit more in your 20s, and I was only 11. And surprisingly, I didn't have extreme weight loss. In fact, my weight was holding steady for my height and age. He ended up doing a biopsy on those hemorrhoid-like things and discovered that they were benign, no cancer, and they were just inflammation marker skin tags. He agreed to continue seeing me, and in one of my appointments, he discovered I had a tiny fissure, which is like a little paper cut, next to the rectum. It was not bothering me, however, so he agreed to leave it alone and just kind of monitor me and see how it went. After about a year, the fissure grew so big that the surgeon insisted that I go see a specialist. His nurse ended up finding a pediatric gastroenterologist about 45 minutes from where we lived, and I was in his office within the week. At my very first visit with him, he said, "I have to run some tests to confirm it, but she has Crohn's." And sure enough, on January 13th, 1997, at the age of 12, I was diagnosed with Crohn's disease. But not just any Crohn's disease. I was diagnosed with one of the most rare, most debilitating forms. Crohn's disease manifested in the perineal area. I was started on a medication called Pentasa and a liquid iron supplement because I was extremely anemic. I immediately started feeling better and responding to the medications. My stomach aches got better, although they weren't fully gone, but my energy levels and just overall how I felt was enough for me to say I was doing better. That fissure that had started off as a tiny tear had now grown to a full-on perianal wound. So I was referred out to yet another surgeon. And even though the wound never really bothered me, the doctors were concerned that if we left it alone, it could grow so deep and so big that it would eventually reach my tailbone. So as much as I did not want to, in November of 1997, I went in for my very first surgery due to Crohn's. Little did I know that that was only the beginning of something that would change my life forever. Want to hear the rest of the story? Hit that follow button and stay tuned for part 2 of my life, his story.